and want to also recognize some key staff that are with us. Welcome to Mary Jo Shercliffe, who's Vice President of Operations and Administration, and Allison Adams, Vice President for Policy Foundation for a Healthy Kentucky. So to introduce our featured speaker is Alice Bridges, who's Principal of AOB Consulting. She's past president of our club, chair of the District 6710 Membership Committee, and she's a recipient of the Rotarian of the Year, along with so many other things. Welcome, Alice.
Thank you, President Julie. It's my honor to introduce our guest speaker today. As Kentucky Attorney General, Ben Chandler won a $45 million settlement from one of Kentucky's largest insurance companies in 2001 that was used to create the Foundation for a Healthy Kentucky. Perhaps it was karma then that Ben was named the president and CEO of the foundation in 2016, carrying out its mission to address the unmet health needs of Kentuckians by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. Ben practiced law with Brown, Todd, and Hayburn, and later with Reeves and Grady, before beginning a career in public service. He served one term as Kentucky State Auditor and two as Attorney General, where his accomplishments included creating CASPR, a national model for battling prescription drug abuse, establishing a public corruption unit, and strengthening consumer protection laws. Ben received the Democratic nomination for governor in 2003, but did not prevail in that general election. In February 2004, he was elected to the U.S. House of Representatives, serving Kentucky's 6th congressional district until January of 2013. He was executive director of the Kentucky Humanities Council from 2013 to 2016. Did you know that Ben is an 8th generation resident of Woodford County who finds time for significant civic leadership outside his foundation role, including service on the board of New Vista, which provides mental health and other services in a 17-county area, and is chairman of the Kentucky State Board of Elections. That's an interesting role right about now. I've had the honor of working with Ben and the foundation on efforts to implement trauma-informed policies and practices in Kentucky's schools and institutions, building on brain science to foster more resilient children and families. He is a great champion and advocate for the underserved throughout the Commonwealth. Please join me in welcoming Ben Chandler.
Alice, thank you very much. Can you all hear me all right? Good. Thank you so much, Alice, and I really appreciate having had the opportunity to work with you and the program that you were so instrumental in, the Bounce Coalition and the trauma-informed activities have just really been cutting edge. And we've only just begun on that, by the way, and I'll be talking a little bit more about that. But for those of you who don't know, Alice received one of our awards too, to add to her long list of accomplishments. She got an award from the foundation for her good work, and we appreciate it very much, Alice. Thank you. Having heard that introduction, the first thing you probably figured was that here's a fellow who can't hold a job. He's been in the middle of so many different things. In fact, I spoke to the Lexington Rotary not long ago and figured out that it was the 6th time that I had spoken to them in 6 different capacities. Got to be an all-time record. Anyway, it's wonderful to be with you all, and I really appreciate the invitation. And I want to also mention a few other people. Your president, Julie. Julie and I have known each other longer than either one of us would care to admit, I can tell you. We went to school together, so we go back a long way. And looking through some of the people on this call, Julie, I probably have known you longer than I've known anybody on this call. But it's always good to see you, and we've had the privilege of working with you at KET, the foundation has. Gary Dryden, I notice, is a member of your club. Gary is on our advisory council, and we consider him, in fact, he's the vice chair of our advisory council, and we consider him a highly valued member of our foundation team. I also want to mention Barry Allen, who has just been involved in cutting edge work at the Gaines Foundation. And we've had a lot of opportunity to work with Barry, and that's only going to expand in the near future. You'll probably be hearing more about that in days and months and maybe years to come. And then I want to make a particular and special mention of Susan Zepeda. Susan was my predecessor at the foundation. She ran this organization with an incredible amount of integrity. She was a tremendous steward of the resources. She was the one who was responsible with Alice and her group for really getting the Bounce Coalition and the trauma-informed care efforts off the ground. And that was just one of many accomplishments that Susan had as the leader of this foundation. And I can tell you that everything that we're doing today and are going to do in the future, all of those things are built on the foundation that Susan laid. And so we're just very proud, and it's very good to see you, Susan. With that, I'd like to just tell you a little bit about the foundation very quickly and get into a few other things. The Foundation for a Healthy Kentucky works to address the unmet health needs of Kentuckians, and we do it by trying to influence policy, by improving access to care, reducing health risks, basically the stuff that Alice mentioned. We're a nonprofit, and very importantly, we're nonpartisan. And at a time when so many things are partisan. We are strictly nonpartisan, and that's very important to us. And we have been funded by the endowment that Alice mentioned, and that's really helped us to do the work that we want to do, which essentially is an effort to improve the health of all of our people here in Kentucky. And as you all know, there is absolutely nothing more important than your health. It doesn't matter how much money you have if you don't have your health. Your health is everything. In any event, we believe very much in things like integrity, respect, effectiveness. We want our efforts to make a difference. We want to move needles in health for our people in Kentucky. And you all may not be aware of some of the health numbers that we see in Kentucky, but they're really, it's pretty tragic when you look at our numbers across the board. Just as an example, we lead the entire nation in cancer, which is just an appalling thing for Kentucky to be a leader in, and we are. So those are the kinds of things, and the list goes on, but those are the kinds of things that we want to try to affect with better policies statewide and with grants that we make. The philanthropy that we've been involved in over the years has seen the expenditure of almost $30 million around the state. We started with 45 million. We've given out 30, and now we've got, I think the latest market report says we're in the mid 60 million range. That's good math to be able to give away 30 and still have 60 left when you started with 45. So we're trying to be good stewards of our resources, but at the same time, we're doing things like you see on this slide. We're building coalitions. We're activating our board members. We've got 15 board members around the state. We've got 60 some odd members of our advisory council from one end of the state to the other. And we are statewide, by the way. So we have to pay attention to, everybody here in Kentucky, 120 counties, and it's not the easiest thing to do. And if 60 some odd $1 million as an endowment sounds like a lot, but in the foundation world, it really isn't that much. And we've got to work hard to basically to hit above our weight. And we do that by trying to focus on policy. We've done some philanthropy stuff, but we've moved to have a more hands-on and more direct approach in policy as we move forward. And we do that by lobbying the legislature, which, if any of you all have done that before, is it's an interesting process, I can tell you. We are very interested in communications. We try very hard to get information out to people because information is absolutely crucial, not only to getting policies changed, but to having people hopefully engage in better health behaviors. So that's a big, important part of what we do. We had focused a great deal on philanthropy in the early days, but as I say, we're moving a little bit more toward direct policy work. And we address our health issues, or trying to address our health issues in that way, because we think that we can have more impact through policy. If we can get policies changed in the Commonwealth of Kentucky that lead to better health, it's going to affect a whole lot more people. We've got a slide, I think it's the next one, that shows the difference between types of intervention. There it is. You can have, for instance, this example came from the Healthier Colorado Foundation, changing policies to require daily physical education in schools increased physical activity by 23 minutes and cost only about 15 cents per student. Now, this is a measurable difference. Meanwhile, building a school playground cost about $51 per child and only increased physical activity by about 6 minutes per child. So you can see that for the expenditure, if you can get policies changed, the impact's going to be a whole lot wider. And that's really important to us. We're looking at trying to impact the social determinants of health. So many people pay attention to health care. And of course, that's very important because having health care is extremely important, but it's only a small slice of what having good health is about. So much of it is about behaviors. It's about situations that you find yourself in, socioeconomic factors. And we want to impact these sorts of things, but things like education, poverty, all of those kinds of things, the trauma-informed care effort, for instance, they all affect these socioeconomic factors. And if we can do something relative to that, we have a much better chance of having a big impact on health. We've had some policy wins so far and through the history of the foundation, and we've had some just recently. Here's an example of some of them. The insulin bill that passed in the General Assembly. As you all know, diabetes is another big problem here in Kentucky. And we've got lots and lots of people who suffer from it, and they were really getting hit hard by insulin costs. So we've gotten at least a start on that by affecting some people, cutting their required payments to $30 starting next year. So that'll be a nice change. We advocated changes to the child immunization mandate bill. We supported mental health parity, which is, again, a very important thing. And it will increase access that people have for mental health and for substance abuse disorders. And last year, we advocated for the increased minimum age to buy tobacco products. We got that moved up from 18 to 21. Not only in the state, but nationally. So it was a really big deal. E-cigarettes is an area that we have been focusing on quite a bit because we've had an explosive growth amongst young people in their use of e-cigarettes. And you can see right here that the tax that we got put on e-cigarettes is now higher or equal to the tax in most or all of the surrounding states in Kentucky. So that should deter some of the e-cigarette use that we're seeing amongst young people. We also had a tremendous victory with tobacco-free schools. And this is one thing, the map says it all here. House Bill 11 that we got passed a couple of sessions ago caused school systems, and you would have thought, that they were already tobacco-free, the campuses, But no, that wasn't the case. Of course, it has been in Jefferson County for a while, but throughout the state, it had not been the case. And you can see how many counties did not have those policies. All the ones in white there, the lower is the lower map of Kentucky, and you can see that we only have a handful left now that don't have tobacco-free laws, and that's going to make a big difference for young people. We know the data shows that it makes a big difference, and we're determined that we don't do anything unless the data supports it. We also had a cigarette tax increase. It was 50 cents. It was the largest tax increase on cigarettes in the history of Kentucky. Wasn't what we wanted. We wanted more. We wanted $1 or more. We couldn't get that, but we did get 50 cents, and it paid immediate dividends. We saw cigarette purchases decline by 36 million packs in Kentucky in the first year that this was in place. That was over a 10% decline, which compared to declines in other years that averaged around 3%. So it clearly had a significant impact. Other things that we've done, and some of these things Susan Zepeda was very instrumental in, childhood obesity prevention, built environment activities. We had a program called Investing in Kentucky's Future. It tried to address in certain areas in Kentucky the obesity problem that we have here in the state. And it also was the progenitor of the wonderfully successful bounce activity, which dealt with the ACEs problem. We lead the nation in ACEs here in Kentucky, which are adverse childhood experiences. That's the trauma-informed care thing. And all of the studies show that if you've got high numbers of adverse childhood experiences in your life, you are almost certainly consigned to both poor attainment in the area of education and poor health for the rest of your life. It's unbelievable, the causal effect. So addressing this is going to be a big part of what we do. And because of that successful program in Louisville, we have now moved out to have a pilot project in Russell County, which is a rural county in southern Kentucky. And we hope to expand it much further than that, including maybe some efforts on the policy front. More on that you'll be hearing later. Important to us, extremely important to us, are our collaborations. In fact, they're not just important, they're absolutely essential. Without collaborating, without putting coalitions and groups together to try to work on some of these almost intractable problems in Kentucky, we've got no chance at all. We've just absolutely got to do it. And we have put together several partnerships that you see on your screen there. And those we hope will move us in the right direction. We also have seen right along the way that there has been a tremendous gap in health amongst different communities. We see it, you see it right there in Louisville. You see it, in fact, very markedly in Louisville. I've called it a tale of two cities. You've got the East End and then you've got the West End. And if you live in the East End, your life expectancy is going to be 77 years. If you live in the West End, it's 69. That's a difference of 8 years that you can expect to live just because of where you were born. And that's just not right. That's something that we have got to address. We've got to be serious about addressing. And consequently, the foundation has been very involved in health equity matters, and we will continue to be focusing on that. We also have been doing a lot of public service announcements on issues that we think are current and important. The e-cigarette issue that I mentioned earlier, it's just exploded with youth, not only high school students, but even middle school students. And these products are chock full of nicotine. And what you'll find is that The nicotine is so, you get hooked on it so very, very easily that it's very difficult to drop the addiction. And people who start and get hooked early on nicotine end up being smokers for life, many of them, users of tobacco products. So we've got a couple of these PSAs that I'd like you to watch very quickly.
This isn't a flash drive. This is an e-cigarette or a vape. It's small, I can hide it in my hand, and it comes in flavors kids love. But it's full of nicotine, and that's bad. My friends told me it's safe, but I don't think so, because it has just as much nicotine as a pack of cigarettes does. I could get addicted to this. I'm only 11 years old. It can harm me, it can stunt my brain growth, and it's just bad. I thought it was just water vapor, but it's not. I just didn't know.
E-cigarettes are more addictive to teens than adults. It's really making me mad that companies are getting rich off of hurting kids with these flavors.
A lot of people don't know that one little pod of this e-cigarette is equal to a whole pack of cigarettes.
If my friend said everybody's doing it, I'll be like, they're doing it because they're addicted to it. They can't stop.
Talk to your children about e-cigarettes.
I just didn't know.
I just didn't know.
Now those are PSAs that featured Kentucky kids. All of those kids are Kentuckians. The first young lady that you saw was 11 years old when she did that, and it's just quite remarkable. But we thought that they were quite compelling, and we got them out around the state best we could. We also have been involved in the effort to get more people vaccinated. And I think we all know, and you all have heard what kind of issues we've got there. First, we had a problem with not having enough vaccines, but in pretty short order, we have now gotten to the problem of having plenty of vaccines and not enough arms for them to go in. So we're trying to figure out how to help in the effort best we can to be able to get us back to normal and get some of the people who are hesitant to get the vaccines. And we did a poll, and the poll was very interesting. You may have heard some of the data related to the poll, but about 30% of Kentuckians were vaccine hesitant in our poll. And they basically said they were either not going to get the vaccine or might not get it. But the good news in the poll is half of the ones in that category, half of the 30% of adults who said that, were open to more information. And we were able to find out, of course, who their trusted sources were and what kind of information they needed to convince them to get the vaccine. And we've been working to try to figure out a way on the grassroots level to address that problem. And it is now a grassroots problem. We're going to have to dig it out to get us where we need to be, and that's herd immunity. The reason why, and you all probably have heard all this, but the reason why we need to get to herd immunity is there's a great concern that these viruses, if they have enough hosts, will mutate and actually outrun the vaccines that we've got. And so as much as we rely on the vaccine, imagine how tragic it'll be if the vaccine no longer works on the new variation of the virus. So it's really important that we get as many people vaccinated as we can. We've got a couple of videos on this too that we have put together, also showing some Kentuckians. And I don't know, one of these people I know is going to be very, very familiar to you all. But Ashley, if you could go ahead and try to play those, that'd be great.
I have faced serious illness in my life that got me closer to death than I wanted to be. Cancer, brain tumor, stroke. But if I can take a vaccine that protects me, in this particular case from death, I'll take it. And I took it. I took the COVID-19 vaccine for the family and the life that I love. During the pandemic, we lost one of my family members, and the family came together for the funeral, and my mom was like, "I'll see you there." I didn't know that I had COVID at the time. But I told my parents, "I won't meet you. I just don't think it's safe." Now, I thought I was protecting myself from all the people that were going to be there. I was protecting my family. Had I met with my family when they all got together, I would have been the one to give everyone COVID. It would have been me. That rocked my world. And it was hard. When I had COVID, I couldn't breathe. I was so tired. I couldn't do anything. I took the vaccine because I love my life. I love my family. We don't know enough about COVID, but we know one thing. The COVID-19 vaccine can keep you from serious disease or death. That is enough for me. I've got so much more to do. I have so much love to give. I told my family to do the same. I want you around. I want to be around. Who do you love? What do you love? Is it important enough to take a shot at life? And I mean that literally. A shot that can keep you here a little longer to do the things you love and to be with the people you love.
Isn't that wonderful and moving?
I do everything I can to help my patients stay healthy.
Hi, Angie, how are you?
Very well, thank you. How are you?
I'm good. It's nice to see you today.
Things we used to take for granted, like going out to eat, going to a ball game, shopping, spending time with our family and friends, have all been impacted by COVID-19. I encourage my patients to get the COVID-19 vaccine as soon as they are able. The vaccine is safe, effective, and it's our best shot at getting back to life. Take it from me, get your COVID-19 vaccine.
Those are just a couple of examples of the PSAs that we're trying to distribute throughout the state. And of course, the testimonial of Don G., if you weren't moved by that, I don't think you can be moved by anything. It really is powerful in my judgment. But getting this stuff out, I think we realize how important this is. And now we've got to, as I said before, we've got to absolutely dig it out. We've got to go on the ground. We've got to get local physicians involved in a serious way, local pharmacists. This is one thing that we found in our poll, that those are the people, your own physician, your own pharmacist, those are the folks that people who are hesitant trust. And if we can get those people on a local level voicing their support for the vaccine and the importance of getting it, we might get to where we need to get to in Kentucky, because it really is. I mean, you all know it. It's about saving lives, and it's about the health of the people that we love, just like Don G. said. Anyway, the whole vaccine issue is something that is unfortunately become controversial, and we're going to take that up in our health policy forum. We have a forum named after Dr. Howard Boast, who was a former public health really legend here in Kentucky, and we're going to be talking about that in this September in a statewide forum. We hope that you all could join us in that forum. It's going to be virtual. We don't know what the situation is going to be like in September. We may be able to get together, but we just didn't want to take any chances. So it's going to be virtual, but it's going to have some tremendous speakers, and we're going to take this on head on about vaccine hesitancy, about the never vaxxer group, the people who just don't believe in vaccines or who think that vaccines cause more difficulties than they solve. One of the biggest problems we've got in our society today is misinformation. And it's very, very difficult for people to know what is true and what isn't. And so often it depends on what their sources of information are. It's so different from the time when I grew up. But we're trying to get good information out to people as best we can. Because of the work of many of my predecessors in this foundation, it is a trusted source for information. And we're going to continue to be involved with that. And we're going to continue to try to improve the health of our people best way we can along the way. It's our only goal. It's our only agenda. And that's a little bit about what we do. And with that, I'm going to stop. And if there's time for any questions, I'll be happy to take some.
Ben, it's always wonderful to be with you, and all the hats you've worn, you've done them just with such bold, courageous leadership, and in your new role. We so appreciate our health is probably the most important issue for all of our citizens. And just thank you for your leadership and your vision in helping move that needle. There's a lot of questions here, but the one I want to go ahead and start with first is from Charlie Kastner, and he wants to know your relation to Albert Chandler. So if you could share a little bit about that.
Well, I'm Albert Chandler III, and he was my grandfather, for better or for worse. But he was quite involved in a lot of things, and some people still, probably most of you all aren't old enough to remember him, but a lot of you are. And he was very involved in Kentucky, and I got my interest in public service principally from him.
Yes, very, very good. Henry Heiser, can you unmute to ask your question directly?
Hello, Henry. How are you doing?
Hello, Ben. Thanks for being with us. I typed a question. So basically it said, I'm an active volunteer in a food bank, and I'm disappointed in what is being shipped to poor kids, like Hershey's milk and salad dressing packets with 14 grams of fat. And also in our public school system, the sugar and fat content of the food that is given for the free and reduced lunches are just appalling to me. And I wonder if you and your organization can help stop this and give these people healthy, nutritious food.
Well, we are tremendously interested in this. And this is one of the things that program that I mentioned earlier that started under Susan Zepeda's leadership was particularly interested in, getting into the schools and trying to get them to be interested in healthier foods and interested, of course, in more physical activity, which ultimately will get their weight down to a manageable level and make all of them healthier. The problem is real. It's significant. It's a huge factor in poor health in this state. You're exactly right about diagnosing the problem. The solution is a little bit more complicated because you've got money factors, financial factors. The legislature doesn't want to put more money into better food. And one of the difficulties we've got in our society, Henry, and you know this, fresh vegetables, good food, good healthy food tends to be more expensive. And what we've got to do is figure out how to get this healthier food to people who need it at a lower cost. Some of the food that you're talking about, the food with high calories and very little nutrition, is the cheaper food. And in most cases, people think it tastes better too, because a lot of research has gone on to try to make it taste good and try to get people hooked on fatty foods and salty foods and the things we all love, you know, the snack foods, but the things that make us all fat. And it's just, we would love to get where you think we ought to go. I totally agree with that. And we are working on it at the foundation. But boy, it's tough particularly with the Kentucky legislature, to make a whole lot of inroads in that regard. Because among other things, it just costs a whole lot more money right now.
Ben, you're looking good. Thanks for joining us.
Yes.
Thank you, Henry. Always good to see you.
Thank you. Bye.
We have another question here, Ben, and this is from Roland. Roland, are you unmuted?
I am now.
Okay.
Ben, I was wondering if when you were discussing the bill on the capping the cost of insulin, whether that included needles. I'm very aware of a recent situation where the insulin is affordable, but the needles are highly priced.
Well, of course, this points out, Roland, and thank you for that question. It points out all of the different complications you've got in everything that you try to do. We want to try to help with that issue, and right now it does not include lowering the cost of needles. And as I'm sure you also know, that is a political issue in and of itself, providing needles to different folks, particularly when you get into the area of drug use. Now, that's a little bit different, but anytime you say needles to anybody, they immediately think somebody's going to run and use it for some illicit purpose. But the insulin is actually only applies to a certain group of people, and right now it's the people who can be regulated by the state employees and folks like that. It's very, very hard to pass bills that require private companies who produce products to produce them at a required price. It goes against what a lot of people view as free enterprise and the market, and letting the market control. But the problem, of course, is that you don't have working markets in cases like this, and you're talking about life or death issues. And people were paying, in some cases, $1,000 or $2,000 a month for this insulin alone. People who have diabetes, and diabetes is a massive, massive problem in Kentucky. Not only do we have a huge percentage of people who have been diagnosed with diabetes, but we've got quite a large chunk of the population who are pre-diabetic and don't even know it. And diabetes is one of the most difficult health conditions that you can have, because it exacerbates everything else that you're dealing with, and makes it worse. But again, it's a problem that's not easy to solve, but we've made some progress in it anyway, and we'd like to make more.
Thank you again, Ben. We really appreciate you being here with us and sharing this wonderful information, very informative. And again, Rotarians will get the information out about the BOAST forum that they will be hosting to make sure everyone's aware of the dates. And that is a wonderful opportunity to come together with other like minds and learn how you can make an impact. So Ben, thanks again to you and the team that are with us today, to Mary Jo, Ashley, and Allison. We're so glad you all could be on the call, and appreciate you all.
Thank you so much, Julie.
Yes, good to be with you.
Good to be with you all.
Next week, we're delighted again to have our featured speaker, Susan Elkington, who's president of Toyota Kentucky. Think about who you'd like to invite as your guests and get their name and email information to our staff, and they will make sure and send you the link. Again, just want to thank everyone for being with us today for this wonderful presentation by Ben. And congratulations to Tony for his leadership at the DePaul School, and so glad to partner with him and the good work they're doing. And I also want to just share, if anyone would like to know more about the Rotary Club of Louisville, stay on the line and we'll have a short What is Rotary session. Everyone, thank you for being here. Be well. We are adjourned.